past all the stores and they were walking past, and there was sort of a lot of humor that came about into like, oh, you need this, I've got this, so, and they were laughing a little bit, but I wondered if it is that they even know what it is that bipolar is, or drug addiction is, or depression. And I wondered if there was a sort of, maybe in terms of just general knowledge, doing a survey before, what do you understand from mental illness, and having something like this, and then asking them after if there was anything that they've integrated from just having, them coming to the stores and talking to people, and that would just be on a very basic level, just checking, was there any insight or information gained, or were they just picking up pamphlets and moving on and not gaining any information from it. That for me was standing up when I was talking to somebody else. I wonder if they even know what mental health is, or what is it that we offer, or what actually is a private psychiatric facility, or Sanka, or SADAG, or NAFA.
I think it's been achieved. I think that's really valid, before and after survey.
And I think wellness is also very much gauged by the individual. Because what one would equate as me being well might be very different in standard somebody else deems as that's their well. So I think it is, like a before and after could be helpful, because it is different for each individual. So I may not be feeling completely happy with everything in my life, but I'm comfortable where I'm at, and that might be well. For somebody else, they want to be happy and wake up positive and joyful every day. So it is going to be different depending on what their base level is, what's familiar to them, their surroundings.
For me, also the important thing is around the fact that, and it comes through just again now, people don't know what it is. People don't know what it means to be depressed. People think that if you get your exam results and you didn't score an A and you feel bad about it for half an hour or 2 hours, that's, I was depressed. They don't realize what depression is. I mean, we had somebody at our stand that said, people think I'm bipolar, and I don't think I'm bipolar, I'm just moody. So that person clearly don't understand what the clinical diagnosis of bipolar is, and sometimes you can't go into the clinical details with people every week. But maybe that's a very good starting point, especially because of certain cultural barriers as well. That these are students, these are young people that one day will be 40 years old, and that will have children, and that will educate their children that this is not the way you deal with mourning, and this is not the way, and it's okay for you. So it's actually quite a powerful time now to educate people on the basics. And maybe if you educate 100 students, 10 of them might grasp it, and the other 90 might not give it. You've changed 10 families. You've potentially changed 10 families. So that might be a good indication to run programs to say to people, let's talk about what is depression, or what is bipolar, or whatever. So people understand what it is, and even if they don't identify it within themselves, but they identify it within their families. We often get patients that come in from various cultural backgrounds, and where they've now been told to come into this hospital, and they actually don't know what's wrong with them. They actually don't know why they're feeling this way, and then they leave after the program. And it's remarkable that they actually accept that it's okay for me to feel like this, despite the fact that my grandmother or grandfather has a different perspective about it. They've taken their medication. And that's sort of, I think, the most important thing, whereby people are exposed to it. And somebody earlier said that there is a great stigma, especially in African culture, around psychiatry. But what we've also seen in the last 4 or 5 years, we've seen a significant increase in the number of African people coming for help, which means that something's changing out there. And that change starts with younger people.
I'm seeing the same pattern in our own practice.